in lobules with no invasion of the basement membrane. LCIS does not produce a mass on calcifications and is usually discovered incidentally on biopsy, characterized by discohesive cells lacking E-cadherin adhesion protein, often multifocal and bilateral. Treatment is tamoxifen to reduce the risk of subsequent carcinoma and close follow-up. Low risk of progression to invasive carcinoma. Invasive lobular carcinoma. Invasive carcinoma that characteristically grow in a single file pattern. Cells may exhibit signet ring morphology. No duct formation due to lack of E-cadherin. Prognostic and predictive factors. Prognosis in breast cancer is based on TNM staging. Metastasis is the most important factor, but most patients present before metastasis occur. Separate to axillary lymph nodes is the most useful prognostic factor given that metastasis is not common at presentation. Sentinel lymph node biopsy is used to assess axillary lymph node. Most important factors are estrogen receptor, progesterone receptor, and HER2 new gene amplification. Overexpression status. Presence of ER and PR is associated with response to antiestrogenic agents, for example, tamoxifen. Both receptors are located in the nucleus. HER2 new amplification is associated with response to trastuzumab. Herceptin, a designer antibody directed against the HER2 receptor. HER2 and nu is a growth factor receptor present on the cell surface. Triple negative tumors are negative for ER, PR, and HER2 nu and have a poor prognosis. African American women have an increased propensity to develop triple negative carcinoma. Hereditary breast cancer represents 10% of breast cancer cases. Clinical features that suggest hereditary breast cancer include multiple first-degree relatives with breast cancer, tumor at an early age, premenopausal, and multiple tumors in a single patient. BRCA1 and BRCA2 mutations are the most important single gene mutations associated with hereditary breast cancer. BRCA1 mutation is associated with breast and ovarian carcinoma. BRCA2 mutation is associated with breast carcinoma in males. Women with a genetic propensity to develop breast cancer may choose to undergo removal of both breasts, bilateral mastectomy, to decrease the risk of developing carcinoma. A small risk for cancer remains because breast tissue sometimes extends into the axilla or subcutaneous tissue of the chest wall. Male breast cancer. Breast cancer is rare in males. Represents 1% of all breast cancer. Usually presents as a subareolar mass in older males. Highest density of breast tissue in males is underneath the nipple. May produce nipple discharge. Most common histological subtype is invasive ductal carcinoma. Lobular carcinoma is rare. The male breast develops very few lobules associated with BRCA2 mutations and Klinefelter syndrome.